Breast augmentation is one of the most common procedures performed by a plastic surgeon, and certainly one of my most commonly performed procedures. The typical patient that comes to me is either a young patient that really doesn't have much breast volume at all, or a patient that is somewhere in their 30s or 40s that have had children, and through their pregnancies, their breasts have changed. And those changes usually include, loss of some breast volume, some flatness to their breast up top, or some sagginess to their breast. So by restoring it, that usually implies you can increase the fullness, give them a little bit more cleavage, and give them a little bit more of an uplift without a formal breast lift. And so just by doing that, that usually improves their self-esteem significantly, and the patients are significantly happier. They're able to fit in their clothes, they're able to go to the beach, wear a bikini, and show off their bodies again. Breast augmentation has come a long ways. Before there was just saline implants. Now we have both saline and silicone implants. So my patients have that choice. They also have a choice of incisions. They can have the incision underneath their breast, around the nipple areolar complex, or underneath their armpits. And it's their choice. And once you come in for your consultation, we kind of go through the ins and outs of each of those choices. And you get to pick. You get to pick the incision, you get to pick the type of implants, and you get to pick the size. A lot of my patients come in saying, are they safe? I personally think that they are safe. Just like any device, however, there can be issues. And we'll go kind of through some of those issues during your consultation. Breast augmentation is an outpatient procedure now. You have the procedure, and the procedure itself takes somewhere between an hour and a half, and you get to go home. One of the biggest fears my patients have is, what the recovery is like and how much it might hurt them. And so I've eliminated, or tried to eliminate that fear by incorporating something called a breast pain pump into all of my procedures. It's a pump that's filled with pain medicine, and it goes through a little catheter, goes into the breast during your procedure, and that pain medicine just continuously runs through no effort of your own. And so because of that, you have no pain for 2 to 3 days. So the biggest fear that most of my patients have, which is the pain, I think has been relatively eliminated.